So welcome y saludos. Thank you everyone for joining us today to hear about perspectives from Latina nursing professionals during COVID and beyond. Today's Tanoma Consulting Latinx Health webinar series will feature 3 Latina nursing professionals who will shed light on the current status of COVID-19. These courageous nurses have been at the front lines serving our communities and training aspiring nurses, our future leaders in the field. So we're really grateful to have them join us today. Before we begin, my name is Lisa Aponte-Soto. I'm the founding president and CEO of Tanoma Consulting and the lead sponsor for today's webinar series. Tanoma Consulting is a national nonprofit consulting firm providing transformative, culturally responsive research, evaluation, and training services to advance health, education, and workforce equity. And our vision is simple. We aim to create innovative strategies that foster equitable practices for all communities. For more information, you can visit us online at www.tanomaconsulting.com. It is my pleasure to first introduce to you our first presenter, Nurse Susana Gonzalez. Susana is an amazing nurse advocate and leader who fully commits to everything she embraces. Her purpose in life is to leave this world a little bit better than she found it. She's an exemplary role model and servant leader dedicated to mentoring and developing the next generation of bilingual, bicultural, Spanish-speaking nurses and promoting all levels of education and changing their lives. Susana currently serves as a nurse consultant and educator, providing education services for a home care agency in Chicago. She also serves as an adjunct faculty at an ADN and a Master Entry Schools of Nursing program. Among her strengths, Susana excels at developing and leading operations, academics, simulation skill learning, and partnership development coordination. Throughout her career trajectory, she continues to be at the forefront of healthcare issues for women, infants, children, and the nursing profession. Susana has served on many boards of directors at the national, state, and local levels, as well as advocacy groups and advocacy committees, including the March of Dimes, Mujeres Latinas en Acción, and the Chicago Bilingual Nurse Consortium. And I'm telling you, that's just a few of the many she serves or has served on. She is also an active member of the National Association of Hispanic Nurses for Illinois. She is past president and serves as a national board member as well. Recently, Susana volunteered proudly on several medical missions in Puerto Rico post-Hurricane Maria. Susana has received numerous recognitions and awards for her compassionate servant leadership work, including the Regional Volunteerism and Service Award for Nursing Spectrum, the Illinois Maternal and Child Health Coalition, Aspira Excellence in Health Award, March of Dimes Outstanding Nurse of the Year Award, the National Association of Hispanic Nurses Community Service Award, and the March of Dimes Jonas Salk Nurse of the Year Award for her commitment to service. And again, these are just a few of the many recognitions that she has been honored with. She holds dual Masters of Science in Nursing and Masters of Health Administration degrees. Next, we're going to hear from Dr. Elizabeth Aquino. Dr. Aquino is the Associate Director for the Master's Entry for Practice program at DePaul University School of Nursing. In this position, she's responsible for overseeing the daily operations of the largest graduate nursing program at DePaul. Aquino is the current president of the American Nurses Association, or NAN, of Illinois, which is a professional association that represents the interest of Illinois' over 190,000 registered nurses. She's currently treasurer for the NAN and immediate past president of the NAN Illinois chapter. Through her nursing background, research, and community service, Aquino has focused on the many issues that ethnic minorities and underserved communities face that impact their health. Aquino has demonstrated her deep commitment to helping others through her volunteerism, community service, with various nonprofit organizations where she has shared her expertise to help address health disparities. She has promoted a vision of healthcare advancement in Illinois and nationally by serving as a leading voice for Latinx nurses on local and national boards, advocating for the nursing profession and providing services and resources to Latinx communities. Aquino's clinical background is in critical care, specifically surgical trauma intensive care nursing. She completed a bachelor's degree in psychology and biology from the University of Illinois at Urbana-Champaign, a master's of science in nursing from DePaul University, and a PhD in nursing science from the University of Illinois at Chicago College of Nursing. And we also have with us today Nurse Edith Bosque. She's currently a registered nurse working on the cardiology telemetry floor of a major metropolitan hospital. Edith received her Master of Science in Nursing after completing the graduate entry program at the University of Illinois at Chicago in December of 2019. She has worked diligently in the Latino community as a project coordinator for the Chicago Hispanic Health Coalition since 2013, and she is also an active member of NAN. She was honored, in fact, to represent NAN as a United States Health Foundation Diverse Scholar in 2018. All of these stellar women represent the National Association of Hispanic Nurses, as you've heard me say, not just at the local and state level, but also some at the national level. And on behalf of Tanoma Consulting, we thank you, Nurse Susana, Dr. Aquino, and Nurse Bosque, for joining us today. Before turning it over to our guest, we wanted to share a little bit about the association. As you see here, their objectives are to assess, collaborate, and dialogue, to assess the safety and quality of healthcare delivery services, to collaborate with other organizations that are committed to serving bilingual, bicultural Spanish-speaking communities and increasing the pipeline of Hispanic nurses, and to contribute a forum of Hispanic nurses to analyze, evaluate the healthcare needs of the community. And if you want more information, you can visit the website at www.nanillinois.org. We at Tanoma Consulting feel it's important that before we begin today's conversation that we acknowledge that our country has been experiencing an extremely difficult time as a result of COVID-19. The pandemic has exacerbated the existing inequities in communities of color. Most recently, the distress has been compounded by the unjustified deaths of George Floyd, Ahmaud Arbery, Breonna Taylor, many before them. Our communities are collectively taking action in solidarity with the Black Lives Matter movement to speak out against years of persistent systemic racism and structural inequalities. Regardless of your background, it is a highly sensitive time for everyone. The recent demonstrations in support of the Black Lives Matter movement have brought thousands of people to congregate and convene across the country and across the world. And they have been convening, of course, as we've seen, in very close proximity. Many have worn face masks or coverings, many have not. And the concerns are about the threat of COVID almost seem secondary or insignificant, almost an afterthought right now, given the climate that we're in. But particularly now, given that we're at that stage where we're beginning to reopen spaces and regain some normalcy, and people continue to demonstrate and come together and protest, as well as in other spaces. Some concerns, particularly for those of us in the healthcare field, is the resurgence of COVID-19 cases, and we have seen a spike already. There are 25 hotspots that we've heard of as of yesterday that are of concern in our nation. Given that Latinos in the US continue to have among the highest rates of COVID-19 cases, particularly in Chicago, it is concerning how the community might be affected. So our guest today will help us unpack this. What is COVID-19? What is the current status of COVID-19? Are there treatments for it? Where are we in that process? Is there a vaccine? Do we still have to be worried about taking precautions? And what's the impact on the Latino community? So without further ado, to get us started, Susana, can you please share a little bit with us about what COVID-19 is, or coronavirus, and walk us kind of through the process of how the virus spreads and how we can continue to stay safe?
Welcome, everyone. In addition to our esteemed host mentioning our purpose and our mission of NAN, I did want to share that we do celebrate the culture and caring and spirit of Hispanic nurses. who we believe are the leading voice in our healthcare and communities today, which is why we're here and committed to you as non-Illinois. So what is COVID-19? As you know, it's a respiratory illness and it spreads from person to person. This is a virus that causes what we call COVID-19. It comes from the coronavirus family. And it was first identified in an investigation of an outbreak that happened in China, as we all know. And this was tailored as early as January, and here it is in June. And we are continuing to see the effects of a spread that is considered a pandemic, because not only was it in China, but it's gone clear across the globe to other parts of our industry. So how is it spread? It's spread in the same manner as many viruses. It is a respiratory disease. It is spread through droplets. People cough, people sneeze, people laugh, and we projectile excitement, and our respiratory droplets get into the nose and mouth of others as it's inhaled into our lungs. This specific virus loves your lungs mucus, your lungs lining, your epithelial. So sometimes even 6 feet isn't enough when people are excited, or in our cases of what we're seeing, lots of dialogue and verbiage you can carry past 6 feet. So what are some of the symptoms? And again, similar to some of the aches and pains of viruses that we have treated and deal with, you know, you will project some fever. A lot of individuals are with low-grade fever. A lot of documentation of fevers as high as 107. These are severe fevers, which obviously cause a lot of harm to the body. There's the cough. The alarming one is the shortness of breath. If anyone's ever had a difficulty breathing, it is a very scary feeling when one has to gasp for air. So shortness of breath is a severe kind of symptom, and it alarms us as healthcare providers. You know, we get sore throats, the sense of smell and taste, and lots of GI discomforts, among others that we hear from our patients, from our residents. We have lots of symptoms. Sometimes they're between 2 days. Sometimes it comes in on day 7, 8, or 9, and the active symptoms become more pronounced. Hence, an average incubation could be within a week, between, 3 to 5 days. People are still very fluid, you're transmitting, you're shedding the disease. So sometimes when we tell someone that has mild symptoms and they feel, pues, yo me siento bien, I feel okay. I'm a little tired. I don't taste my foods. My throat hurts. But we encourage hydration. It's a very debilitating, dehydrating disease. And we got to promote fluids. We've got to promote cleanliness. We've got to promote rest in these individuals, and the active disease is still spreadable. So if I'm in a home with my son and my sister and my brother or my husband, they are prone to be exposed because you're the one factor that could shed to your environment. So when 80% of our patients are at home, I work in a fantastic, wonderful home care agency, and we take care of patients in home. No one's been denied health care in our agency or services, and those residents are cared for tremendously by home care workers who wear proper PPE, and nurses who go see the healthcare component of it, and everyone practices good safety measures, and we reinforce and we teach and we join in to be engaged to make sure that we continue to protect ourselves and the people that we serve. That's very, very important. As you know, in the severe cases that end up in a hospital, Most are there because of the pneumonia in both lungs and the fact that they cannot breathe. The virus eats up the lungs lining and it congests and it accumulates and it becomes a very debilitating, fast-paced illness that with comorbidity factors such as congestive heart failure or high blood pressure or diabetes or cancer, our patients then suffer even more so. So we've heard, and we'll share it again, and it won't change, the information on prevention. You know, Lisa mentioned at the beginning how cautious we are because the doors are open in our city of Chicago. Yet yesterday, almost 1,000 new cases were diagnosed in the city and in the Illinois state. Yesterday, 116 people lost their lives due to the COVID virus. So somewhere it hasn't gone away. It's shifted places because of what happens in our lives and where it becomes, but it's still here. So we have to be very conscious to stay focused on hand hygiene. Your hands are the most precious thing that carries more things of diseases than we can ever know. We can transfer. So we have to be careful to hand sanitize and make sure your hands are dry after the usage, to watch how you touch your nose, your mouth, your face, and then how you transfer it all to other areas. When we cover our noses because we cough or we cough away, sometimes if we need to have a tissue and discard those tissues. You know, old is let me fold it up and put it in my pocket for later. We have to really be conscious of trying to help contain what we can. And it's very difficult to stay home. We are healthcare persons and we know that people have worked not feeling well. We know that our people of the community and are the people that are raising their families and living in the community, they need to go to work. So if they got to go to work, then we want them to cover their nose and their face. If they have face shields, they should use them. We need to really practice sanitizing and cleaning and wiping, and those become our best friends today. So we have to encourage that. I'm a flu shot getter. So I really promote as a nurse, as a healthcare provider, as a first responder, as anyone that deals with the public, protect yourself, protect them. And on a yearly basis, get your influenza vaccinations, your flu shots, and really try to be conscious of what you can do to prevent others from getting ill and also be a role model. This is the time for us to role model that coronavirus is not over and that I still need to protect myself and protect you. So I think the next slide goes into my colleague Edith. Where have my hands been?
It's really easy to just go about your life not thinking about what you're doing. From moment to moment, you're thinking about the next task. But as we talked about, this virus can live on surfaces, and we still don't know how long it lives on there, how easy it is to connect to other things. So it's always, I think, better to err on the side of prevention. So you go pump gas at the gas station. People have done studies saying that that's one of the dirtiest things because no one ever cleans it. That's not a task that's delegated to anybody at the gas station. The keyboards, if you're in a public space, those keyboards are maybe wiped down, but not necessarily disinfected. When you go to the grocery store, your keys, when you're walking around from place to place, touching things that are not your property, that are communal, then you touch your keys. That could transmit it. Money, of course, again, we don't know how well it retains this particular virus, but I've seen studies where most money has cocaine on it because at some point it passed through somebody's hands or other bills that have drugs on it. So it can be found on almost all money. Cell phones, again, it's something we're so used to grabbing. I like to use touchless payments when I'm in the stores right now, and it works really well, except that if I've already touched a bunch of other things, Then I go to get my phone to do the touchless thing. My phone is now contaminated. It's no longer clean. So I always make sure to disinfect it when I get home from doing whatever outings I've done. And again, when you're out, anything that you touch that other people have touched, any door handles or, elevator buttons, doorbells, that sort of thing. Remote controls, again, if it's in your home and nobody in your house has COVID-19 or any other illnesses really that are communicable, then you should be fine. But if one person is still working because they're an essential worker and they're touching it, they might be inadvertently bringing it home. At the grocery store, I think most people are very aware of this. So a lot of people try to wear gloves. But you have to remember, in a healthcare setting, we use gloves regularly, but we also change them regularly. So for my work at a hospital, every time I go in and out of a patient's room, I sanitize my hands with alcohol-based sanitizers. If I'm going to do anything for the patient, I put on gloves on top of that. I do whatever the patient needs me to do, remove my gloves, and sanitize again before I go on to the next patient or even to any of my own work at my own computer. So it's just kind of the awareness of how you're using these things to protect yourself. Definitely think about the order in which you do things. And the easiest thing to do, especially right now, is to carry hand sanitizer and sanitize regularly. If you sanitize before you go back into your car, if you sanitize before you get into your house, wash your hands when you get in the house. As you're putting groceries away, wash your hands again. These are all maybe above and beyond what's necessary, but they're really easy things we can do to take care of ourselves. There's a lot of words that have become part of the national consciousness. Community spread. That just means that this COVID-19, people have become infected, and sometimes they're very aware of where they caught it, but other times they're just not sure. If you're taking public transportation, you're exposing yourself to a lot of different people that are strangers. Sometimes it can happen we've seen cases where churches have opened up and people have gotten sick from that. And it's unfortunate, but this is how we know it can spread, through community contact and things that we were normally do beforehand. So the recommendation is social distancing, which means trying to avoid doing anything that requires you to be in a big group of people, anything that a lot of people come in and out of. So it's very difficult, especially for the Latino community, because we're so community-based. We like to be with each other. We like to have large gatherings. Many times families are larger, so there's a lot more people involved. But again, the idea is that's going to increase your chances of catching this, or if you're already sick, spreading it. 6 feet is what we're recommending, but it's not, as Susana said, the best thing to do. It's just what we think is more likely to be safe. And I talked about congregate settings, which are these large spaces like shopping centers and theaters, the things that haven't really opened up yet. But keep in mind that that's a lot of close contact. So a lot of people ask if they should be tested. You can always call your healthcare provider. I'm a big fan of telling people that you need to have an open communication with whoever that person is. If you don't have that, if you feel like you can't have that, maybe it's time to look for a new provider. Oftentimes, if you have a physician, an MD, they'll also have a nurse line, or they'll have some sort of other way that you can communicate. Your insurance might have one. And I've done that. I've called my insurance and said, hey, I need some help letting me know if this is something I should see a doctor for or not. And I get a recommendation from somebody who knows. So for this, if you have a fever, cough, difficulty breathing, definitely call, because these are the most prevalent symptoms of COVID that can progress to worse things. If you've been in close contact with somebody, like let's say you expanded your social network a little bit with the opening, and then that person comes down with it, yeah, it's a good time to get tested. If you've recently traveled to somewhere where there's a lot of COVID-19, so you might say, oh, I live in this suburb, nobody here has it. Well, that's fine. But then if you come into the city or go to somewhere else that has a lot of it, you're going to be more likely, again, to be infected, and therefore you want to know. So your healthcare provider can work with you. In earlier times, they were saying you had to contact them and they had to let you know where to go. That's changed, which is good because have been more tests. So there are more ways to get testing if you want it. So the tests and treatments. The tests most people are getting right now work pretty quick, and it's called a PCR nasal swab. So what it is a thin Q-tip-like plastic swab that gets inserted into the nose, and it has to reach all the way up to the back of your throat. So it's very uncomfortable, but only for like 3 to 5 seconds. So that then is taken to the lab and analyzed using PCR technology to see if you currently have that virus in that part of your body. And that's usually an indication that you have the virus that can spread then systemically. So therefore, if you have it in your nose, you're going to get it in your lungs, you're going to get it, attacking other parts of your body. The other test that is available now is an antibody test. What that does is it lets you know if you've been exposed to it and have then your body's immune system created antibodies against it. So an antibody is what your body creates to make sure that you are fighting off any infection, and certain antibodies are very specific to certain things. So for this one, they've created an antibody test that tells you, yes, you've been exposed to COVID. And right now you have antibodies. What we don't know is how long those antibodies survive and how well they can help somebody else, which goes to our treatments. Right now, there is no cure. We can definitely treat the symptoms. Like Susana said, acetaminophen, because fever is a huge thing that you're going to see. Plenty of rest and staying hydrated. You have to take good care of your body, and those are easy things we can do. There are lots of trials going on. So one of them is the convalescent plasma transfusion. So like I mentioned, the antibodies, if a person has been exposed, their body created antibodies, but they're now healthy again, they're not presenting any symptoms, they're not able to spread the virus, but their blood still carries some of these antibodies. So what has been done for other things and that are attempting to do now is to transplant basically those antibodies into another person. And that's done using a blood transfusion or simply taking out the plasma portion, which is rich in antibodies, and putting that in the person who is currently sick. There's a drug called remdesivir, which has been used for other viral illnesses and has worked really well for those. So they're thinking this is also a viral illness. This could also be effective. And we've heard a lot about hydrochloroquine and even mixed with azithromycin, which is an antibiotic. And a lot of these things are being tested right now internationally and nationally. Here in Chicago, different hospitals are doing different trials, specifically with the population that we work with, which is a lot of African American and Latino people. None of those results have been so conclusive that we know exactly what to do, but some of them are proving really helpful. So the best plan is still prevention, and once you are sick, seeking medical care. Now that we're opening up, how do you stay safe on the go? So you got to really assess the risks of activity for yourself. We know that older populations and people who have other illnesses are more likely to have more detrimental consequences from getting infected. So you really need to assess it for yourself. Because of how we know that it spreads, you want to ask yourself, is it going to create close contact? Like if I go to the hairdresser because I need a haircut, that's going to be pretty close contact, and it's not going to be brief passing close contact. You're going to be there for 20 minutes, half an hour. So that again increases your chances of getting contaminated either from them to you or you to them. One thing you can do is wear the mask continuously. So that's like a protective barrier for you to give it or for you to receive it. It's best if both parties are wearing it. It's still not 100%, but it does increase your likelihood of not getting infected. And the probability stuff gets a little confusing, but basically you want to ask yourself, is this important or not? Do I need to go to the dentist? Well, that's really close contact. They're going to be close to you and you're going to be close to them, but it's pretty important, especially if you're having something that can't wait. So I would reach out to your dentist and make sure that they're doing everything they're supposed to do. There's a bunch of new state regulations and federal recommendations on how best to go about these things, but you should do your due diligence and make sure that you're being healthy. And it's something that you kind of need to do. If you're going to the nail salon, again, you're going to be close for an extended period of time, but is that something that you're willing to risk? So you just want to be careful. If you go out to eat, Again, you're maybe not that close together because everybody's, social distancing with these new patios and things, but you can't really wear your mask while you're eating. So are you going to put on your mask to tell the waitress that you need water and then take it back off? There are very little things that I worry about because of my background in microbiology. And I think you guys need to just kind of make that decision for yourselves. We're just here to educate you. And now Liz.
Thank you, Edith, and thank you everyone for joining us. I'll be talking about the impact of COVID-19 on Latinx communities. I think most of us on this call know that health disparities is something that has always been around, especially nurses. We see this in the patients that we take care of every day. We see how social determinants of health, how zip codes, access to care all impact the patients that we see and the outcomes once they leave our hospital, or hopefully do. But COVID-19 has really allowed for everyone, the nation, to see how communities of color, Latinos, African Americans have really been hit hard by COVID-19 and unveiled the health disparities that are impacting the number of positive cases and the number of deaths related to COVID-19. We've all been under the stay-at-home order, and it's actually seen as a privilege because many of our Latinos have had to continue to work during those stay-at-home orders because they work as essential workers. Many in the food industry or even helping hospitals keep the environments clean and sterile. So many of them are working on the front lines and therefore are being more exposed to COVID-19. Many are living in multi-generational households or crowded households or even working in crowded conditions. So those are things that are also contributing to the higher number of cases that we're seeing. Also, we know that many have limited or no access to healthcare or health insurance, especially within our undocumented community. And so that also puts them at higher risk of not being able to seek the resources that they need if they are COVID positive. So, we tend to see delays in seeking treatment, which only often creates poor outcomes for the Latino community. So this is just a map showing the number of deaths and cases for Latinos. And as you can see, there's 42 states plus Washington, D.C., where Hispanics or Latinos make up the greater share of confirmed cases. So that's on the right-hand side. Now, African Americans actually see larger numbers and deaths, but if we look at specific age ranges, actually older Latinos are matching the same death rates as African Americans, which is, still something that is unfathomable, that we are seeing these stark differences and disproportionate numbers of people of color having higher incidences of positive COVID cases and the higher death rates. Now, this is just showing you in the states where we have larger majorities Latinos, showing you the cases of deaths and cases of COVID positive for Latinos. So I just picked Illinois and our state. You can see the dotted line there going through the two bars. That represents the proportion of Latinos, the population. So as you can see in Illinois, the number of cases far exceeds the percentage of Latino population in our state at 42%. And then as far as the deaths, we're at a little over 20%. And so you can see in other states, again, with majority Latinos, how the proportion of Latino population is related to the number of cases and deaths. And on the right side of the screen, you'll see that there's a lot of unknowns. So there's many cases that there isn't a link to ethnicity. So my concern is that there's Latinos within that proportion. And so even if you look at Texas, there's 78% of cases with unknown ethnicity. So my fear is that there's a great proportion of Latinos that sit in there and we don't have the information to tell us how many of Latinos are within that group. So there's a lot of missing information, so we don't have the full picture, but the picture that we do have is not a good one. So we want to continue to work to make sure that we are helping the Latino community navigate through COVID-19. So this is from a table that shows us the breakdown of zip codes. So out of the 15 Illinois zip codes with the most cases, we have 11 zip codes with Latino majorities. 60639, I used to live there, I have family there, and that's ranked number 2, which is very scary. So again, I spoke to some of the reasons why we think that we're seeing the higher number of cases, but we really need to take action to protect the community members within these zip codes. So what is currently being done? Well, we have some really great organizations that are working hard to meet the needs within those zip codes and then just more globally. So really what's key is to make sure that we have resources and messaging that's both in English and Spanish. So I gave some examples here from the CDC website that really explained best practices during COVID-19 to protect yourselves and your families and to know what those symptoms are. So they have really put out some great infographics for both in English and Spanish, and we just need to make sure that those are really being widely shared. So I know that organizations like the Hispanic Nurses have really focused on messaging that can go out to community members in both English and Spanish. There's access to housing for self-isolation. For example, an essential worker contracts COVID-19 but lives in a multi-generation household and needs to self-isolate. There's some state, city options to help with that. There's several support groups and grants that can provide funding, especially for the immigrant communities. And then there's some messaging that you can opt into, text messaging, to get just some updates on guidance and self-care information through IDPH. As I said, there's some funding sources through organizations who've been able to get donations and funds in order to help communities in need, and especially those Latinos who have been put out of work and requiring assistance to be able to buy groceries or pay their rent and just buy basic needs, buy their medication that they need. That is very scary to think that people are continuing, and probably even more so now, having to choose between whether to buy food or their medication. Because as nurses, we know that if a patient is not taking their insulin or their heart medication, that they are going to come into the hospital sicker. And if on top of that, they have COVID-19, their risk of recovery is going to be even worse. So we want to make sure that people are still having access to their basic needs and medication so that they have a better fighting chance to beat COVID-19 if they do contract it. There's also been some legislation that has been recently passed. The Latino Caucus and Latino legislators have worked really hard this session in order to make sure that there's more funding, specifically going to FQHCs, the federally qualified health centers, who take care of the majority of undocumented community members and also people who don't have insurance or limited insurance. So it's really great to see that there has been more funding put into those clinics in order to care for the most vulnerable population. There's also a new law that's been put in place allowing for, starting July 1st, undocumented seniors will have access to Medicaid resources. So that means that they will be able to have the health insurance, health resources that they need to be able to also get through this. There's a lot of great resources on the LatinoPolicyForum.org and IllinoisUnidos.com, but I do want to also mention a couple of other things. So news media appearances to raise awareness has also been key. We need to make sure that Latinos, legislators, community-based organizations, nurses, that we're all making sure to contribute to media, whether that's being interviewed by newscasters or promoting things through social media, to really get this information out to people who need it. And there's been a lot of great work already. I know non-Illinois members have been contributing to that media, but I know that there's many other organizations who are continuing to do that to get the voice and information out. So what else must be done? I shared a slide previously that showed that there was a lot of information that we didn't know, where could mean that there's a gap in knowledge of actually knowing who is contracting COVID-19 and really the true accurate picture of how many people are dying of COVID-19, specifically within the Latino community. So we need to make sure that data is being captured accurately and shared. We also need to increase the number of testing sites and making sure that questions like citizenship status are not included. We don't want people to be deterred from getting tested because we want to know if they're COVID positive, so that way if they're tested as positive, that we can help them isolate and not continue to get others sick. We also want to make sure that testing is able to be done without a referral. That also creates another barrier. If someone needs to get a doctor's or provider's referral to be tested, we want to try to eliminate as many barriers as possible. Of course, making sure that we have culturally and linguistically appropriate information that we're sharing, but also when we discuss contact tracing, in order to make sure that people understand what that means and what goes into that, and so that they can make sure that they're not contributing to community spread. And that's where our community-based organizations who are already invested in these communities and are doing great work can really partner and promote the information that needs to go out. There's ideas about sending COVID-19 home kits where individuals will have thermometer and just information that they need to be able to protect themselves and their families. Other things that we can't forget about the most vulnerable populations, so those who are disabled, nursing home residents, immigrants, undocumented workers, we cannot forget about them. We have to also make sure that we're putting in protections for them and not leaving them out. And then enforcing occupational guidelines. I think that is really important when Latinos work in factories and are at increased risk of exposures. I saw on where some factory workers were given hairnets to use as a face mask, which is totally wrong and speaks to the fact that the owners of those companies, they're clueless about how to protect their workers. So we just need to make sure that the workers are also knowledgeable about how they are supposed to protect themselves and what is reasonable for an employer to ask them to do, or what should they be advocating for in those workplace environments. And if those needs are not being met, what can they do? Who can they report to? And so we need to make sure that information is shared widely as well. And then making sure that any COVID-19 resources are equitably shared with our Latino community. I'll turn it over to Susie.
Hi, everyone. We do have some final thoughts, and they go along with what the team is advocating for. COVID-19 is still here, so we need to continue to stay calm and continue to be prepared for what the next challenge or what the next barrier is as they come into fruition. CDC is one of our favorite sites. I mean, we are nurses, obviously. We link on and we watch the World Health Organizations. Liz and I are both American Nurses Association members. Liz is our president for Illinois. I'm on her board. We know what our ANA says, the American Nurses Association, the National Association of Hispanic Nurses. We have position statements on these as well. So we're up on tune. It's a fluid disease and we're constantly adapting to what we need to do. I do listen to our mayor and the governor of the city and to the president of the Cook County Board as well. This is my city. It's where I live. It's where I work. It's where I serve. So it behooves us to kind of pay attention to what's happening in our world, especially locally, and being very mindful. I think there's a lot of discrimination. There's a lot of stigma. You heard the highlights of Liz and the data, and every day we can panic or we can just be grateful and mindful for what is our part and how do we help others stay well, and how do we stay well, and how do we move forward.
So there were lots of great comments and questions, but first and foremost, thank you, each of you, for taking time, because I know how busy you must be, to just take a moment to share all of the wealth of knowledge that you've gained over the past several months, but just your general expertise as nursing professionals in the field. So one question I think, Susana, you may have addressed a little bit was regarding hand sanitizer, but is there such a thing as to whether you lose effectiveness if you're sanitizing too regularly?
I personally believe since the hand sanitizers, remember there's hospital approved hand sanitizers that have been out in the market since I believe the 80s, and they're very well developed, and we use them as hospitals in most healthcare institutions. It is the form of hand sanitizing that is approved in institutions of healthcare for in between washing with hands and soap. Now, is there evidence that some individuals have sensitivity to skin and they need to use other things or develop some cautions? It's the same thing with gloves in our institutions, but there is lots more evidence that it is an approved way to maintain your hands clean in between getting into the soap and the water. So I'm an advocate, and it depends on, whose market, but definitely protect your hands.
Now, there was a question also about what age group, particularly among Latinos, is most at risk. Maybe Edith, if you can touch on that. Is it just people that are older, like 60 and older, 59 and older, or are younger Latinos or individuals also at risk?
Well, because of what we mentioned earlier, younger people are more likely to be in the workforce. And unfortunately, Latinos tend to be essential workers predominantly. And so they're more likely to catch it. The more you expose yourself to potential sources of infection, the more likely you are to come down with it. I know a lot of people who have sent their children to live with their grandparents, where the grandparents and the kids are completely secluded and not going out for shopping or anything. And then the one designated adult, who's usually in that age range, is the one who's doing the shopping, going to work, doing all the things, and then just dropping things off for the grandparents and the children as a way to decrease their likelihood of getting infected.
Now, for people who may have needs to continue in terms of perhaps having health issues where they may need to continue appointments or are concerned about what the right thing to do is, I know you touched a little bit on, dental appointments, for example, but what about someone with a chronic health condition? If they need to see a specialist, should they keep that appointment or not?
Well, most clinics, primary providers have switched to telemedicine. You can still communicate with the provider and let them know what you're experiencing and what your symptoms are so that you can receive some treatment. And I think that's the important piece. We don't want people to delay, especially if they have a history of diabetes or chronic disease. We don't want them to delay seeking treatment because that will only decrease their chances if they do get COVID-19 of recovering from it. Or we may see them in a sicker position once they go to the hospital. So there's many ways to still access care.
Now, as a quick follow-up to that, if someone needed lab work, right, you may be able to perhaps take your blood pressure at home and do some of those things to kind of track your blood pressure if you have high blood pressure and are taking medication for that, for example, or test your A1C levels and determine where you're at and have that kind of conversation with your provider about that. But what if someone needs other type of blood work or other follow-up testing? What should they do? What is your advice if they're concerned or even fearful of going into a clinic or a hospital to get testing?
Well, hospitals are putting procedures in place so that their patients can come back, even for elective procedures now. Most hospitals are reopening and really do want to offer their patients the security that it's okay. It's safe to go into the hospital, even though it's scary. But they are doing the same things that we're seeing, like with restaurants, making sure there's social distancing. If you have to be in the waiting room, making sure that, even scheduling appointments, that they're really going to decrease the potential of coming into contact with more people. So I would say that as long as the patients have discussed it with their provider and identified that that particular test needs to be done right now and can't wait, that they go ahead and do it. And I encourage them to do that because that would only delay and cause further issues that could have been avoided.
I wanted to add to what Liz was saying. Absolutely. Today, in the last couple of days, providers have actually started calling their patients for elective procedures. Their patients, as Lisa was saying, that need chronic disease follow-up. It's time for your hemoglobin A1C. It's time for your lab test to check if your white blood counts are okay or your RBCs are okay. So trust your providers. Something Edith said was have a good relationship and communication with who your providers are that are giving you healthcare, so that you can expect expectations that they need and you set yours as well. They do need to keep you 6 feet apart. They do need to maybe register you real quick while you're still in the car, and then they bring you in. They don't let you sit in the lobby all clustered. They're whisking people straight into their exam rooms and being seen and, exited. So procedures are being put in place to keep you safe, and participate in that procedure and ask questions.
Now, there's a lot of other great questions. Thank you for your responses so far. But I did want to cover one more because we're almost out of time, and we wanted to share a few resources with you, additional resources with the audience as well. So the one question is we touched on, and I think it was maybe Edith that touched on perhaps how the flu vaccine can be helpful. What about the pneumonia vaccine? Is that also something that might be helpful for individuals that perhaps are immunocompromised or have sort of higher risk? Do you recommend it?
Absolutely. Depends. You can get the pneumococcal vaccine as early as in your 50. It depends if you're a compromised, asthmatic, if you are a compromised patient with comorbidity factors. Again, your healthcare provider, your nurse practitioners, your physician assistants, your physicians, your FQHCs that are taking good care of you, they have a recommendation threshold and follow that guideline. But if you're already at age, if our clients are over the age of 65, we highly encourage them all to get vaccinated. It is very, very important, and it does protect their lungs.
Well, thank you. Really, again, great questions and really insightful responses, and hopefully hearing from 3 expert professionals in nursing care helps us have the accurate information that we need. So thank you again to our 3 amazing guests. Hopefully we're going away with a clear understanding, not just of COVID-19, but exposure to what we need to do to continue to stay safe, particularly now that we're returning to workspaces, businesses, and reopening, and many are gathering even in solidarity against police brutality. Thank you again to our 3 amazing guests for their time and for sharing their clinical expertise. They are true heroes. Hopefully, we're going away from this session today with a clear understanding of the risk due to COVID-19 exposure and what we need to do to continue to stay safe, particularly now while more people are returning to workspaces, businesses are reopening, and many are gathering in solidarity against police brutality. And here we wanted to share with you some resources. I know Liz did such a great job sharing various different resources that are available from housing for those who need to self-isolate, and other resources from that are available to seniors, including Medicare and Medicaid, resources available through the Latino Policy Forum or Illinois Unidos. But we wanted to share some additional resources as well. Of course, there's the Chicago Hispanic Health Coalition, if you're interested in various resources related to Latinos. Salud America has a lot of various different resources available on their site. They have downloadable fact sheets that speak to COVID-19, but other resources for food assistance, as well as, you'd have to take her down.
Zoe. You are ridiculous. You smell like a dog, but that's okay because you are one. Also, I'm kind of shaky because I still haven't been out of my phone. And I'm going to take you downstairs. And I'm not.
Also, Salud America has a lot of different resources on their website, from food assistance programs, as well as various different resources and fact sheets that you can download about COVID-19 or Latino health. So you can reach out or visit their website for additional information. And of course, our guest speakers today are all from the National Association of Hispanic Nurses, or NAHN, here in Illinois. And you can go to their website if you want to contact them for additional information or additional resources. We also wanted to share, if you're interested in getting tested, you can use the site locator to get testing. Your income doesn't matter. Your citizenship status doesn't matter. You can get free testing at a location near you, and there's various sites that are still open and accessible. Just visit chi.gov/COVID test or chi.gov/COVID test. If you know anyone that is in need of food assistance within the state of Illinois, the Northern Illinois Food Bank has a site locator that you can use by visiting the site listed on the screen. There are also various different organizations that have been coming together, and even restaurants and food suppliers that have come together across the country and locally that you can
There are also.
Yeah. There are also various different restaurateurs and community-based organizations that are continually coming together to provide food assistance support throughout the Chicagoland area. Most recently, the Latino Institute, or Instituto Latino. Oh, I said it wrong. Most recently, El Instituto de Progreso Latino offered food support. So you can look out for those different resources, or you can contact NAHN or even the Chicago Hispanic Health Coalition to learn more about those organizations that are coming together to provide assistance. If you're experiencing any issues with regards to workplace safety or have concerns about your employer not providing proper PPE or proper distancing in the workplace that will allow you to feel and stay safe, you can contact Workplace Rights at atg.state.il.us. At Tanoma Consulting, we're also featuring various different
instead of saying at Tanoma Consulting, say at Tanoma Consulting. At Tanoma Consulting, go at Tanoma Consulting.
Okay.
Or and at Tanoma Consulting.
Okay. And these are just a few of, I had it written down here. Let me redo that. And if you have concerns that your employer is not maintaining a safe and sanitary work environment to minimize the spread of COVID-19, or not providing proper PPE or safe distancing, you can contact Workplace Rights at atg.state.il.us. And these are just a few of the various many resources that are available out there. And of course, as I mentioned earlier, Liz shared several other resources that are available as well. Before we close, we also wanted to share a few announcements about the upcoming events being hosted by Tanoma Consulting. Many of us may be experiencing issues with sleep disturbances due to the current events. So next week, we're going to be hosting clinical psychologist, Dr. Marty Martin from Sesti Sleep. So you can join us on Thursday, June 11th at 1 p.m. Central Standard Time. And Dr. Martin is going to share several strategies to help us get more restful or Sesti sleep during these challenging times. Next month, We're also going to host 2 additional sessions, one on tobacco usage, smoking cessation, and how it impacts Latinos, particularly youth. We've seen an increase in the usage of e-cigarettes, so we're going to talk about that and the impact that it's having. We're also going to host a session that's going to discuss the status and the future of higher education as we prepare to potentially return to classrooms, dorms, and campus life in the fall. So we're going to talk about how we're going to stay safe in those times. And if you would like to learn more about upcoming sessions or future webinars, you can visit us online at www.tanomaconsulting.com, or you can follow us on social media. If you have suggestions about any topics for upcoming sessions or areas that you're interested in having us, if you have suggestions for topics for upcoming sessions, we'd love to hear from you. So please do complete the post-session survey. It should literally take you less than 5 minutes to complete. It has 4 questions. But if you prefer to, just send us an email at info@tanomaconsulting.com. And if you'd like to reach any of our presenters today for a follow-up conversation or questions, their information appears on the screen. And in closing, we want to remind everyone the importance of continuing to follow proper guidelines and safety precautions, not just for yourself or your loved ones, but as your civic responsibility to keep everyone safe. As of yesterday, there were over 900 new cases of COVID-19 in Illinois and over 100 deaths. Unfortunately, the threat of COVID is still a reality. Until there's a vaccine available, that the only way for us to continue to stay safe and continue to flatten this curve is for us to continue to take those safety precautions. And that's really the only way that we've been able to get to the place we're at now, to get into starting or the beginnings of stage 3, where we're able to start regaining some normalcy and being able to re-engage in businesses. So please continue to do your part. We also want to remind you to be kind and loving to one another. You never know what someone is experiencing within their context, their lived experience, and their reality. These are very difficult times for all of us, particularly our brothers and sisters in the African American community. So check on your friends, check on your neighbors. We encourage you to learn about ways that you can be a part of the conversation. What the fuck is you have a serious problem. Can you just go away until I finish? I can't hold them in. Just go away.
I'm nothing and absolutely nothing. I don't know what I could do.
So please check on your friends and neighbors. And just remember, together we can truly make a difference. And I want to leave us with one more thought. And I want to leave us with one last thought that Susana shared in her personal notes in her bio that I hope that we can all live by. And Susana lives by the philosophy that if there's something that she can do for now, then let it be so. For we may not know what this path. And I want to leave us with one last thought from Susana's personal note in her bio that I hope each of us can live by. Susana lives by the philosophy that if there's something that she can do for you now, then let it be so. For we may not walk this path again. We don't know what tomorrow may bring. We don't know what the future may bring. So it's most important that we act now towards supporting one another. Gracias again, Drs. Aquino, Nurse Gonzalez, and Nurse Bosque, for all of your contributions today, but your continued contributions and efforts to our communities, for giving selflessly as heroes and guerreras to not just the community, but to our emerging scholars and nurses in the field. And thank you everyone for joining us today. Peace and love.